Welcome to Family Awareness Talk Show. In this episode, we will be talking about X-rays, MRI. Many questions are in our heads. What is this field and how can be safe of X-ray radiology? What are the safety we have to take? What are the precautions we must be aware of whenever we go to an X-ray center or a hospital? We will have Dr. Raquel Alam, radiology, doctor in radiology at the American University Medical Center in Beirut. Dr. Raquel, many people aren't aware of when we go to the hospital to make an X-ray for the arm, for the brain, or MRI or a scanner. You will explain to us about this field more. And they take their children with them, and sometimes the husband takes his wife with them. What is this field about, and how people see this field?
Well, actually, it's a large field. We have multiple type of examination. We have some ionizing examinations, such as X-rays and CT, as you mentioned, and we have other non-ionizing radiations, such as MRI and ultrasound. So there are other also modalities such as PET scans and nuclear medicine. So for X-rays and CT, it only causes radiation to the patient who is doing the examination. But there is no risk of radiation to his relatives or to his wife, for example, who is accompanying him. Because the X-ray is only used when taking the image. It will hit the patient, and then it will not get retained in his body and then released after the examination to his relatives or to the patient who is accompanying him.
So they don't, patients who are being exposed to such radios, they are not carrying it to other people.
Yes, for X-rays and CT, yes. For other imaging modalities, such as PET scans, we use radioactive materials. And these radioactive materials can get retained in the body for a short period of time, like 2 or 3 days, depending on the radioactive material that we use. In this scenario, we usually advise the patient not to get in contact with patients that are vulnerable, such as pregnant women or children. And in that case, we suggest for the patient to drink lots of water so that the radiotracer can get excreted in the urine.
Mm-hmm. Okay, I want to ask you, many doctors say that pregnant women shouldn't be exposed to X-rays often. Why?
Yes, sure. Because X-rays are ionizing radiations. Mm-hmm. They have harmful effect, certainly at a certain dose. For example, the dose from a chest CT is higher than the dose of a chest X-ray. And there are many harmful effects of radiation. For example, it is known to be teratogenic for the fetus, especially in the first trimester of pregnancy. It can cause the death of the fetus or some organ malformation. Mm-hmm. Also, in the second or third trimester, it can cause carcinogenic effects. For example, it can induce cancer, it can cause gene mutation. Wow. That's why we do advise if we can use non-ionizing modalities such as ultrasound or MRI. But of course, sometimes the risk of not doing an examination, for example, the risk of not diagnosing a pneumonia, which is an infection of the lungs in a pregnant patient, is higher than the risk of doing an examination, diagnosing a pneumonia and treating it. That's why it's all about risk and benefits, and it's person dependent. And also I want to highlight that not all the examinations are highly radiating modalities. For example, a chest X-ray will give only a 0.1 millisievert to the patient, and those received by the fetus will be even low. And 0.1 millisievert is equivalent to traveling from Beirut to California. So it's equivalent to the background radiation that we get when traveling. So it's not a big deal.
It's not a big deal.
Yes.
Okay, what's the difference between an X-ray and ultrasound effect?
Sure. Ultrasound is a 100% safe modality when we are pregnant because it does not use X-rays. And that's why we do follow-up of pregnant patients by means of ultrasound. X-rays, X-rays and CTs, they do use radiation that can cause, as I said, ionizing effects on the fetus and on the mother. And that's why ultrasound is 100% safe during pregnancy. X-rays and CTs are done, but if they are really needed.
Yeah, sometimes, you know, people who suffer from headaches or migraine headaches, let's be specific, they go to doctors, and then the doctors expose them to EMG test, I guess.
Yes.
The test sometimes does not show them the clear result of what they need, because the patient would be still suffering from headaches or migraine headaches, as we said. Why doctors would ask them to go for a scanner?
Yes.
What is different between these tests and the scanner test?
Yeah, sure. Actually, we do CT scanner if a headache has been long-standing, if it is a very severe headache, because we want to rule out any organic cause of headache. And by organic cause, I mean any tumor that is in the brain, that is causing increase in the pressure of the brain and causing the headache, or any other abnormality. And if we do not find any cause, then we will think about others, such as stress-related headache or migraine. So the first purpose of imaging is to rule out any other cause of headache that may constitute a threatening to the life of the patient.
Oh, that's good.
Yes.
I want to ask you, what is the effect of a scanner like in comparison to a regular X-ray?
You mean radiation dose?
Yes.
Yes. Scanner use multi-slices. It's a like multi-slice modality. We do image every 3 millimeter of a structure, extending, for example, for the brain, like for 8 centimeter. Every 3 millimeter will be imaged, and then it will be equivalent to like hundreds of X-rays that are beating the patient to reconstruct a 3D image after that.
Okay. Do you think that going to such process of scanner, we'll go later to MRI,
Yes.
Or X-rays, would affect the form of a baby or the fetus inside the mother's womb?
Yes, actually, it's a large question. It all depends on the stage of the pregnancy. During the first 10 days of pregnancy, we have the rule of all or nothing. And that means if the patient is exposed to radiation, either the fetus will die, the embryo will die, or he will survive and no malfunction will occur. And after that 10 days, we have a phase called organogenesis, which extends up to 8 weeks of gestation. And during this phase, we have the cells of the fetus that are dividing rapidly to form different organs. And in this phase, the embryo is highly vulnerable to X-ray and to radiations. And in this phase, we can have the highest teratogenic effect of radiation. After that, as we progress in the pregnancy during the second and third trimester, the risk will decrease progressively. So I want just for the people not to be scary. I want to give like a small example. The fetus will have neurological problems. I mean problems to his brain and a lower IQ after that if he get exposed of 100 milligray. But this dose of 100 milligray will not be reached even if the mother will do 3 CTs of the pelvis. And by pelvis, I mean the lower belly, where the fetus is. Or 20 X-rays of the pelvis, which is a high dose. And this is not reached usually with our diagnostic examinations. Yes, so it's very rare.
That's amazing. I want to ask you a very important question that each woman would ask this question to herself. Sometimes people are exposed to accidents,
yes,
and they break their pelvis.
Yes.
So then later they are exposed to many X-rays, you know, until they recover, I guess. How much these X-rays would affect the girl to be pregnant later on? I mean, how much would affect her womb?
Yeah, but if the fracture occurred, you mean before pregnancy?
Yes.
Before the patient is pregnant? Yeah. If the fracture occurred and the patient is not pregnant and she got exposed to radiation, as I said before, the radiation will not be stuck in the woman's body. And so there is zero risk for the fetus in the future. And for the ovaries, if the patient is exposed to like a small dose of radiation from X-ray or CT, the ovaries will not be that affected, and there are not enough data till now to say if there are like effect on the mutations of the genes in the ovaries, but till now there is no proved effect.
There's no effects. Proves that X-rays would affect a girl who will later wanted to be pregnant.
Yes.
That's really interesting.
Mm-hmm.
Okay, I want to ask, when we go to the hospital to do an X-ray, we see that you guys dress something heavy. Why you dress it, and why patients are exposed several times? So what is the difference between the doctors and the patients who are hit by radiology?
Yes, sure. The patient will get exposed to radiation like 2-3 times in his life when he does CT. We do get exposed a lot more than him. That's why we sometimes we wear like lead aprons, mm-hmm. and lead aprons are used only when we got in the room with the patient when he is doing the examination. For example, in certain procedures, when I want to place a feeding tube for a patient, I want to see exactly the position of the tube while I am placing it inside the patient, and so I get exposed with the patient to the X-ray radiation. And hence, when I wear this lead sheath, it will protect me like 97%, 99% from radiation. And this is also for my safety. The patient is in need for this examination or for this procedure, so he has to do it for his own benefit. But me, if I want to do like multiple patients a day, I have to get protected.
Oh, okay, good. I want to ask you now, what is the difference between MRI and X-ray? Because sometimes when people have been asked to go for MRI, the parents are scared, or sometimes the patient himself is scared. How can we tell people not to be scared, and what are the difference between X-ray and MRI, and why we have to do MRI? Okay,
sure. Actually, every modality has its own advantages and disadvantages. For example, MRI gives us lots of details about the soft tissue, about the brain, the muscles, the vasculature. X-rays is a better modality for bones, for fractures. So when we want like detailed examination, we do request MRI. MRI is a safe exam. It does not cause radiation, but it is a highly costly examination. Its cost is like multiple times that of a CT, and it takes longer time. Usually it's around 30 minutes or 40 minutes in a magnetic field.
Okay.
Yes.
Do you usually ask for MRI when you doubt that patients have cancer? Because I've heard that Siemens 7 years ago have created something called Andy-scan. It could show that the tumor is like in a clear image, or it could show that the patient has cardiovascular issues.
Yes, sure. Well, actually, every kind of cancer is an entity on its own. So some kind of cancers have to be imaged by CTs. It's better to visualize this type of cancer by CT, and others by MRI. Usually for young patients, for example, patients who have lymphoma, they are usually young, and we do like follow-up examination every 6 months for them, or every year. For them not to be exposed a lot to radiation, we sometimes perform MRI examination. And by MRI, we can see if there is any new lesion in the bone, any new lesion in the spleen, in the liver. So yes, it's a type of examination that we can use when we want to reduce the amount of radiation received by the patient.
Interesting.
Yeah, but not all the time MRI is better than CT for cancer patients. I mean, it's
Anyway,
dependent on each patient on each cancer.
you mean for you to see a clear image?
Yes.
Okay, not for the patient himself. It doesn't affect his body.
Yes.
Okay,
I mean, for us to have good quality images that can
Okay.
change the management of his disease.
You know, long time ago, we used to hear about chemotherapy all the time. Like any patient who suffers from cancer, he has to go, or she has to go through chemotherapy.
Yes.
A couple of years ago, start to hear about radiotherapy. What radiotherapy is?
Yes. Actually, radiotherapy is a different domain. I do work with diagnostic radiology, and radiotherapy is another specialty, but I can give you like small answers. We do try to hit the cancer cells and induce like breaks in their DNAs, and then the cell will die. And because this cancer cell is highly active, it's dividing rapidly, more quickly than the normal body cells. And hence it will be more affected by the radiation that will get received by this radiation. And this way we can kill the cancer cell.
Okay, so why do you use it as substitute? Like some people extract the cancer,
Yes.
the tumor, so they extract it, and then later they have to go into radiotherapy.
Yes.
Why? Do you because you doubt there's still some cells, cancer cells in the body?
Yes, because sometimes we have like microscopic cells that we want to kill. Other times, radiotherapy is radio frequency. I mean, can be used. It's a type of X-ray radiation that can be used for palliative treatment when the cancerous patient have lots of pain, and we want to control this pain. We can use radio frequency radiation. This can help to reduce the dose of morphine that we can give to the patient, and we will give him a chance to have a better life and a better quality of days.
Okay, I want to ask you a question any cancer patient would ask. How much a cancer patient would be healed by undergoing radiotherapy?
Actually, it depends on the stage of the cancer. Some cancers, if they are too small, stage 1 or 2, they can be only treated by surgery. Other cancers can only be treated by radioactive material, such as thyroid cancer. Other cancer that can be more advanced, such as breast cancer, stage 3, for example, they can be treated by both, by surgery, by combination of radiotherapy and chemotherapy. It all depends on the type of cancer, on its aggressiveness, and on its stage.
Yeah, for example, like lymphoma cancer.
Yes, lymphoma cancer is usually treated by chemotherapy and not by
Yes.
surgery. Yes, I don't think
And then
radiotherapy
you don't go to radiotherapy when people have lymphoma cancer, because I hear that lymphoma cancer is the toughest type of cancer.
Sometimes yes, we do treat if it is like a simple focus, we do treat by radiation. But if it is like highly spread in the body of the patient, we cannot treat by radiation because the patient will get very high dose. But for example, if it is a focal lesion in the spleen, for example, we can hit it.
Okay, how much do you think this technology has offered to the medical field life?
Well, it has changed a lot in the medical field, in the quality of care of the patients and the quality of life of the patients. And yes, sure, it has added to chemotherapy. Chemotherapy is well known to have lots of side effects to the organism. When we can be focal when treating, and treating only that organ without like systemic side effect, it's better.
You know what I heard? I heard from many people that medical tests are the eyes of the doctors.
Yes.
Like, you know, it's
the stethoscope.
Yes, the stethoscope. So what would you say to people who are afraid to go for X-ray, scanner, or MRI? What would you tell them now? What is your message to people?
Yeah, actually, I would tell them that sometimes the risk not taking the examination, not doing the examination, not arriving to a correct diagnosis and not treating their disease is much higher than the risk from radiation. I want to tell them that the background radiation from the cosmic radiation that we receive during 1 year is 3 millisievert, which means it's like 30 times the radiation that we get from a chest X-ray.
Oh, that's
So,
amazing.
yes.
That's amazing. Dr. Raquel Alam, thank you so much for
Thank
being
you.
with us, and thank you for the precious
I
information.
appreciate it.
And thank you so much for watching us. I hope you have benefited from this interview with Dr. Raquel Alam. And be aware, when the doctor tells you that you have to go for an X-ray or MRI or scanner, go for it and don't be afraid.